Hi, my name is Debbie Massaro, and I'm going to be doing the examination of the abdomen on this young man who's graciously agreed to do so. How are you?
Good, thank you.
Good. Is there anything I can do to make you more comfortable today?
No.
Okay. All right, let's get started. Okay, first of all, I would inspect the abdomen. I would use tangential lighting, and I would check the contour of the abdomen. I would check for any unusual pulsations, any abnormal movement, any color. I would check for the any vein distension to see possible ascites. I would also check the skin of the abdomen for color and consistency. Okay. Then I would go ahead and auscultate the abdomen. And we do that next before we palpate and percuss. And I'm going to be auscultating over the general area of the abdomen. I'm checking for hypo and hyperactive bowel sounds. If they were hypoactive, there would be a bowel sound less than every 5 minutes. If they were hyperactive, it would be approximately more than every 35 every minute. Okay, and I'm also checking the bowel sounds for any unusually loud or high tinkling sounds in the bowel sounds. And then I will go to check the vascular. And I know the stethoscope might be a little cold, so it's a cold night. So I'm going to warm it up a little bit. I'm sorry. Okay. I'm checking the vascular areas with the bell of the stethoscope. First, the aorta. And then the iliac, right and left iliac areas. Also, the right and left kidney, renal aorta. I'm checking for any bruits, rushes, or thrills in the aortic areas, and also the femoral. Okay, the vascular sounds are good. And next I'm going to percuss with my dominant hand, tapping all over the abdomen. I'm checking for sounds of fullness or hollowness over the abdomen. Okay, that sounds good. And next I'm going to percuss the liver border in the midclavicular line. I will start in the right quadrant and move up. And when it changes from hollow to dull, I'm going to mark the lower edge of the liver border. And then I'll go into the intercostal areas and percuss downward. Okay, when I hear a dullness, I'm going to mark the upper edge of the liver, and it's approximately 5 centimeters. And then I'm going to percuss for the spleen as well. Start in the lower left quadrant, and this is at the anterior axillary line that I'm checking for the spleen. And I'll start in the in the anterior axillary area and move down. Okay, if there were any enlargement of the spleen, I could possibly hear some dullness below the left intercostal area below the rib cage. Okay, next I'm going to palpate with light and deep measures into the abdomen. And first of all, I just lightly feel over the abdomen, checking for any hard or firm areas, any lumps. Talking to the patient about how their abdomen is feeling. Do you have any pain or tenderness when I'm doing this?
No.
Okay. All right. So next I'm going to go to a little deeper palpation. And if there were any tenderness in the in the upper left quadrant, it could be have something to do with the spleen enlargement, or also it could be gastritis or gastric reflux. Do you have any nausea or vomiting? Have you had any?
No.
Okay. If there were any pain or tenderness in the upper right quadrant, it could have something to do with the liver, the pancreas, or the gallbladder. I'm going to check for rebound tenderness or any guarding in the lower right quadrant. Does that hurt at all?
No.
Okay. If there were any tenderness in the lower left quadrant, it could possibly be something to do with diverticulitis. Any tenderness there?
No.
Okay. All right. So next I'm going to palpate for the liver to see if I can feel the liver edge. And I can do that by hooking my hands underneath the right rib cage, and I'm going to ask you to take a deep breath and let it out. Okay, take a deep breath in and let it out. Okay, if I were to feel any thud or rolling under my fingertips, it would possibly be the liver edge. Okay, I can also do it this way by supporting up under the back and pressing in deeply, and ask you to take another deep breath. Sorry, did that tickle?
A little bit.
Okay, I'm sorry if I made you get ticklish there. Okay, and also I'm going to check on the left side for the spleen, any spleen enlargement. Take a deep breath in, let it out. Okay, nothing? Okay, now I'm going to check for the, to possibly feel the kidneys and support up from the retroperitoneal area, and see if I feel anything. Can you, I know it's difficult, but if you could just try to like relax or blow out like you're blowing candles. Okay, good. Okay, right and left kidney. Okay, I should not be able to palpate the kidneys if they're normal size and shape. Okay, and then also I would feel for the inguinal nodes. Okay, sorry. Okay. Any tenderness? Okay. All right, I don't feel any inguinal nodes, obviously, or palpate any tenderness, or elicit any tenderness on his part. Your bowel sounds were normal, your vascular sounds were good, you didn't have any hyperactivity, you didn't have any lumps or swellings. Any questions for me?
No, thank you.
Okay, all right, thank you, that was very good. Appreciate your help.